One of the greatest risks to cause vascular disease, and also one that can be taken out of the equation, is smoking. And so we would always encourage a smoker to stop smoking. The other thing that will improve blood flow tremendously is walking. With a good walking program, many patients will experience an improvement in their blood flow. And there are medications. We have found that the statins, the cholesterol medications that are given, often will help over time to improve the blood flow. And finally, there are some other medications, such as a medicine called Platol, which will also help the blood flow through some of these smaller vessels. Now, in situations where the blood flow is severe, we will then have to figure out what we need to do to open blood vessels or reroute blood vessels. The first step in that is always what we call vascular imaging studies. And there are a variety, some more invasive than others, but we need a roadmap. Once we've gotten that roadmap, there are a number of treatments that don't require surgery. Most people have heard of balloon angioplasties and stents, which can open vessels with really no surgery at all. There is a needle stick to access the arteries, but once you're done, the patient goes home within a few hours, often with much improved blood flow. And commonly, the imaging studies to look for the blockages and the treatment can both be done at the same time through the same small needle stick. The vascular procedures, that is surgery, that we would use fall into two basic categories. One is where we would make an incision over the blocked artery, usually a short segment that could not be opened with a balloon, and go down to the artery, open it up, and core out the arteriosclerosis, the blocked artery. You could actually remove that much as you might take an egg yolk out of a hard-boiled egg, and leave behind the tough outer tissue, the outer wall of the artery to be closed or patched, and now you have an open artery. If, however, the blockages are quite extensive, as they commonly are, we would do a bypass operation. It is a rerouting of the blood through a new conduit that we do surgically. The goal of any, what we call vascular reconstructive procedure, that's the fancy term for this, is to increase and improve the arterial blood flow and therefore the delivery of oxygen and nutrients to the tissues of the legs and feet.